Welcome back to Diabetic Foot Files, where we explore the science, the strategy, and the deeper thinking behind wound care and limb preservation, and just overall health quality care of life for our patients. Today's episode is a powerful one. We're going to step into the world of artificial intelligence. That's what everybody's talking about today. How data, decision making, and advanced analytics can transform the way we understand our treatments with our physician appointments. Joined by Dr. Asha Zimmerman from Primary Intelligence. He's a transplant surgeon who left his practice to make an artificial intelligence app called Primary Intelligence that is geared to informing patients for their doctor appointments as well as privacy focus. So if you ever wonder what happens when the cutting edge intelligence meets real world clinical care, this episode is for you. Welcome, Dr. Zimmerman.
Oh, thank you. Thanks for having me.
Thank you for having us. So, the first time I saw you was on TikTok, and I just saw you say, I'm a transplant surgeon, and you just said, I hate insurance. And then you got into the thing of what primary intelligence app was, and I was fascinated by it. So, I just wanted to know how did you come into your journey in healthcare?
Oh, yeah, this is a great question. So, I went into healthcare. I tried to set myself up to be able to go into medicine, mostly because it was kind of the only way at the age, 18 to 20, that I kind of knew if I go into medicine, I'll be able to help people. And it's kind of a life mission for me. And so it just kind of made sense to go into medicine. I actually majored in philosophy in undergrad, but didn't really see how that could translate to helping people. So, I went to med school, went to residency for general surgery, and then I ended up going into transplant surgery and hepatobiliary surgery, which is, liver and pancreas surgery, generally speaking, for cancers. And then end up coming back to my home state of New Hampshire to work as a transplant surgeon. And that, whole journey started, when you're, 18, you have to kind of start thinking about if you want to go to med school. And so that's kind of when that all started. But I always had an interest in technology. And so as these technologies were being developed, and much before ChatGPT, I saw a kind of a potential to use these for, health information. We started building. So we started building back in 2024, some of the frameworks that we use in our app today, which is essentially just trying to help patients understand, kind of what might be going on, what they need to talk to their doctors about, and really trying to inform patients. And so that's kind of the journey that we've been on. The hate insurance thing is yeah. I mean, I don't know many people who love insurance.
Yeah.
It's kind of like a necessary part of the current infrastructure, but we're
Hmm.
trying to build something that will help patients. And, in the best case scenario, we would build a parallel system that doesn't need insurance. And so we're starting with an app informing patients and hopefully going to build from there, just kind of a better system, hopefully.
Okay. So when it comes to the healthcare system, what would you like to change the most when it comes to increasing the quality care of a patient's life? That primary
Yeah.
care.
Yeah. I mean, part of the problem with not having easy access to health information is that people tend to live with diagnoses or diseases for a long time without actually knowing it. And during that time period, damage is kind of accumulating, and a lot of that damage is not repairable. And so, in the best case scenario, we always talk about prevention. There's not currently any like really good reimbursement pathways for prevention, but we're trying to figure out ways in which AI can do the things that we would ideally do to help work on prevention or, theoretically early identification of problems. And so that's kind of what we're trying to build, is something that can basically use AI to do the things that we wish we could have doctors do. And so that's kind of, how we see it as how it's going to unfold.
Okay. So, Dr. Zimmerman, can you tell us more about primary intelligence? Like the whole shebang about that amazing app.
Yeah, yeah, yeah. Yep. So my research was in AI diagnostics. And so when we started building these systems, we kind of recognized that a lot of medicine boils down to two things. One is identification of patterns and kind of the diagnosis, right? And the second aspect of medicine is learning a new language. So learning what new terms are, what these disease processes are, and then kind of putting those two things together. And language models are actually pretty good at doing both those things. And so that's kind of what we have been working on, trying to build through kind of like a complex framework. And then, we went through an accelerator, we got some funding, and in October, it was kind of a decision point for me to kind of realize that I either needed to pursue it or, just keep doing research. But so I left practice in October, and we've been trying to build an app. The app itself starts with just asking patients questions to gather more information, and then trying to inform them before their doctor's visit so they can be prepared and ask the relevant questions that they might need to ask or advocate for themselves.
Yes, I love that. Advocate for themselves. I'm going on a little tangent, but I have to ask this question before I forget it. So one thing I've noticed just watching news is a lot of fraud that's been going on, like patients getting misdiagnosed purposely, things like that. Would you think that primary intelligence would help with something like that? So patients can know, be like, I don't think this is right.
Yeah, I mean, I think in the ideal world, what the models that we're going to use and the models that people will interact with will help them get a better idea of the reality of the situation that's affecting them. And so if fraud is going on, right, so say a doctor's labeling them with something but doesn't actually mention it in their visit, and it doesn't seem to come up in any of their other medical records, and I suppose being informed is one way to kind of combat that. It's obviously not the main purpose of our
Mhm,
app, but
mhm.
I think it will hopefully help people kind of identify what's going on and then be able to be more informed when they're either looking at their medical records or interacting with their physicians, or, making sure that they are informed about what tests might need to be ordered or what might not be
Oh,
ordered. Yeah, just giving them a vocabulary of things that their doctor might talk about, what those things mean. Because I think, every doctor's visit is pretty short, right?
yeah.
They're they're asking people to see more and more patients
Mhm.
in a given 8-hour period. And so we want to help patients be prepped before their visit so they can have the relevant conversations to their actual health prevention or healing rather than a lot of the other aspects of the visit. So, if a patient comes in informed, like say they have a, new diabetic foot wound, they don't have to spend half that visit just learning about what a diabetic foot wound is. They can at least go in with some idea of what might be going on.
That's great. So, do you believe the incorporation of AI in healthcare will impede or improve the patient population health and or quality of life, or will it you find it holds? And because I remember you talking to me about like the humanness of
Yeah.
communication, and I know AI kind of takes that away from us now.
Yeah, I think it's going to have to be deployed in very thoughtful ways, but also ways that don't remove the benefits of human communication interaction. So for me, as a doctor, when I go to my doctor, I kind of already have an idea of the landscape of what we're going to talk about. And so then we can have
Mhm,
the real important discussion, which is kind of like, what are my values in my care decision making? What do I want as an outcome? And what is kind of my risk profile? And what am I, like what of the options is best for me specifically? These are all things that AI is not going to be good at. And so
mhm,
really, if we can offload the physician visit with, removing the things that are just kind of straightforward or more algorithmic, then we can have more time for the genuine conversations with the providers. And I think that's going to ideally be kind of the best case scenario and will improve the healthcare.
mhm,
So another example is, there's something called alpha schools where kids are learning predominantly with AI, and the teachers, their classic role is different now. They're more of a mentor in a relationship with the children, and they check in with them about all the stuff that they probably wish they had time to check in with them about when they were teachers, but didn't have the ability to because they had to focus on curriculum and these kind of things. And so I think the relationship will evolve, hopefully, with the implementation of AI. And my hope is that AI will be a net positive in a very large way in the sense of avoiding misdiagnoses and
Mhm.
avoiding clinical errors and improving documentation, reducing burnout, and allowing more time with physicians so people can actually have the good conversations that matter. So that's it. That's at least my hope. We'll see how it actually rolls out, but I think generally speaking, people are trying to build in that way.
Okay. So, I mean, as a physician, you know that there are patients that Google their symptoms, right? Or Medscape their systems. How do you think primary intelligence app circumvents that when it comes to patients coming into the doctor's office with a diagnosis in their head? And, sometimes there are atypicals, correct? And you were like trying to tell them, no, it's this atypical one instead. And they're just fixated on the internet or the app told me this.
Yeah,
How
yeah, yeah.
can we deal with that?
Yep, absolutely. So this is going to be something that will probably be evolving, but the way I think about it is so something like 20% of Google searches before AI were health related. And
Mhm,
the new estimates on current like large language model inquiries are health related as well. And so people are already searching these things. And so if we're not designing something specifically for health related questions, and that includes kind of safety checks as well as kind of grounded assumptions on probabilities and personalized kind of information, then I think we're going to be in worse shape if we're not really building specifically for health and for personalized information. Now that being said, like these language models have problems, they make mistakes, and so they are never a substitute for a physician or provider, right? Like
mhm.
you would never like just get into an autonomous driving vehicle without like kind of like they did years of safety data showing that it's either as good as or safer than classic driving, right? And so I think it'll be kind of an evolution of how healthcare is practiced. But my hope is that it'll generally lead to better interactions between doctors and patients. And patients want to learn more. In
Mhm,
some ways, healthcare has been a little bit of gatekeeping for a long time, right? Like even just finding research articles, being able to interpret research articles has mainly historically been left up to the providers rather than the patients. But patients are starting to educate themselves more. And I think, information, especially like peer reviewed information and good sources of information, we should figure out ways for patients to be able to look at that information and interpret it. Right. Obviously, with the caveats that you know, some of it has to be interpreted with caution and clinicians have experience, which also weighs into kind of the decision making. And so these things are all going to be really interesting to see evolve. My hope is that, generally speaking, people will be more informed as they come into their doctor's visit, and then they can kind of take over their own healthcare, right? And so they can have autonomy in the decisions they're making rather than just kind of being a passive bystander in the decisions of what healthcare is going to, kind of be done to them.
okay. So, just asking, if we applied primary intelligence, let's just say to patients who have diabetes, right? Or diabetic foot
Mhm.
ulcer, do you think we it could start predicting complications like diabetic foot ulcer deterioration before it even begins?
Yeah, I think there is a futuristic role for this kind of technology, right? So I could imagine a world where you have, say, something like primary, which you sync up with your medical records. It knows your last hemoglobin A1C. It knows your other risk factors. It might even know your occupation, which could play an important role. It might be able to see
Mhm,
your notes, and right, you might even take a picture and upload it and say, "Hey, what do you think about this?" And it might kind of flag with enough training data, you could have it flagged for like, hey, this is a high risk kind of wound. You should really start seeing a wound specialist like before this turns into a problem. So I think that's kind of the best case scenario of these AI technologies is you can do something that would otherwise require a human to do that humans like don't really get reimbursed for or compensated for and so don't therefore have the ability to do, and you could offload some of that to AI. Now obviously that's going to be some specialized development, but there's no reason that you couldn't have something like that today.
Okay. So, what do you think when it comes to patient care is the biggest mistake when they rely on things like artificial intelligence or just relying on data to make the decision?
Yeah, for patients, it's the unknown unknowns and like not knowing when the AI is wrong, right? So,
Mhm.
hallucinations are something that have been talked a lot about. Hallucinations largely are diminishing, right? There's ways to deal with hallucinations, but it still could be wrong. And if you don't know medicine, you won't know that it's wrong, right? And so, say say a patient comes into your office and they say very confidently because AI told them confidently, like, yeah, no, I think this is leprosy. And you're like, no, I mean, diabetes. This looks like diabetic foot wound, right? Like the patient without a medical background won't know that the AI is wrong. And so this is kind of
Yeah.
where we need a lot more data. We need to have these kind of physicians or providers in the loop so patients aren't making decisions that could end up harming themselves, right?
Mhm.
So as I'm sure, like, when you use the app, you'll see like one, you have to, agree and affirm when you start using it that you're going to talk to your physician about all the outputs. And then even before we kind of give you information, we have another prompt that like reminds you that this is like that you're not meant to do anything on your own with this information. This is all like to educate you so you can talk with your provider about it and have more intelligent discussions.
More intelligent discussions. I like that one. So, what do you think is the best way a patient can approach? Okay, so this is a new app, correct? So, how do you think a patient can approach discussing, "Hey, I have this app. This is what I found out," and ideally incorporate their physician or clinician in their treatment plan and say, "I want to keep using this."
Yeah, I mean, I think so one easy way is we have a feature where, people can get, like say you're in a classic conversation with any of the language models, it sometimes can be hard to share the output like outside of a text or something like that. But we provide the users with kind of like a PDF summary of what they discussed in the models for their providers so they can send them on whatever kind of secure messaging they have. But we also give them one for questions to consider asking or topics that they might want to go in more depth with their actual providers.
Oh, wow, that's pretty cool. That's awesome.
Yeah. No, I mean, it's, it's, I think, a helpful tool for people to just gather more information. So, like, we've had a couple of nurses who've used it and they find it incredibly helpful for kind of gathering more information where they might not have as much experience. And so, like, for example, bedside nurses oftentimes know when patients are getting sick or have something going on much before the providers do because they're seeing the
Mhm,
patient much more frequently, right? And
mhm.
so sometimes they may not have had the experience of the rotations on a bunch of different services to know exactly what's going on, but they might have a good enough idea that they could use kind of these reasoning modalities that we've generated to kind of, bring up some thoughts of what might be going on so they can actually talk to the patient's provider as well. And so we view this as kind of like the more information we have in the system, as long as there's someone like overseeing that information, hopefully it'll better inform people to kind of advocate either for themselves or for patients.
Okay. So when it comes to primary intelligence, what do you want the ideal partnership be between, because I know it's mostly patient driven, but it's also, like you said, with the nurses, what would be the ideal partnership for a clinician to use this for their treatment plan or it was just with a patient, like the ideal
Yeah.
partnership between a clinician and an AI system like this?
Yeah. I mean, we've had a bunch of providers reach out to us as well, and we've talked about whether or not to provide it as a kind of triage system. So kind of like
Mhm.
a person in the middle that will help kind of gather information. Think about like in classic residency training,
Mhm.
like the
Mhm.
attending has a resident present to them, kind of here's what's going on with the patient, here's what I think it might be. This is kind of briefly what I mentioned to the patient. And, that trainee is not functioning independently. And we kind of view primary filling kind of another role similar to that, where it will hopefully grease the wheels for the provider to have a better conversation and have more information when they're talking with the patient.
Okay. So if every clinician listening today, I'm just focusing on clinicians at this moment, what's one thing you would like them to change about their opinion about AI when it comes to our decision making? Because a lot of people, there's
Yeah.
either ones who are for AI and there's others who are not. Like, absolutely no. I rarely
Yeah,
find somebody
absolutely.
who's in between.
Yep. So I would encourage them to think about it like this. I think, everyone who went into medicine is, generally speaking, their their interest is in helping patients, right?
Mhm.
And so where I think providers don't see the potential is that if you compare it to the patient that they're already seeing that day, AI may seem like it doesn't really have a role because they're already going to be seeing that patient and, they have a lot of experience. But where AI does have a role is in informing patients and letting them know when they don't have an option otherwise. So, like a lot of providers forget that many people go without seeing providers or physicians because they don't have the option to, or they don't have the finances to, or,
Mhm.
they're geographically restricted. And
Mhm.
so, while it's not there yet, the goal would be that with AI, eventually we could help people globally for near free, meaning like when we run our like benchmarking for our tests, we can run 2,200 cases, like real clinical data cases, and we
Mhm.
can do that in about an hour of compute time for about $18. Meaning
Oh.
that like for a classic like in these studies we're doing like diagnostic accuracy, but you can do like a classic HPI and spit out a diagnosis for less than a penny,
Oh,
very
wow.
quickly. Meaning, if you scale that up globally to offer it to people who don't even have access to healthcare, and you can ensure that the diagnosis is getting good enough, right, in the future, that the diagnosis
Mhm.
is good enough on par or better than physicians, then suddenly you have a way to deliver health information to people globally for free, essentially, right? Like for the cost of a penny. That's a very
Mhm.
scalable technology. And so oftentimes in public health, we talk about the value of care delivery. So V equals the quality of the care divided by the cost. And so
Mhm.
if you can deliver the same quality of care or better at a fraction of the cost, you deliver better value care. And so providers should be considering that like AI will allow them to help people for like a much better value, meaning they can improve the quality and they can reduce the cost of care delivery. And so I guess that's kind of what I would say to try and convince people that there's a potential here. And then the other thing is that from a provider standpoint, like I think we need to build this together because
Mhm.
otherwise the big, corporate entities are going to do it in the way they want to do it and they're going to do it at the expense of providers. So that's another reason that I think they should work on trying to integrate and figure out how we do this safely and how we do it and maintain our profession.
Okay, so one thing I noticed when it comes to my profession is that my diabetic patients, like let's say they're fully healed, they only come back when they reopen, okay?
Mhm.
Instead of following up like they should be. Or there's some who, when they're almost close to the finish line, they just decide to like take care of the wound care themselves and then they'll come back if they infected or something like that. Do you
Yeah.
think something like primary intelligence would help diabetic patients with something like that? Just saying, hey, like, because you said it knows when you have a follow up, right? Because
Yeah,
then,
I mean, we don't have that yet, but that's one of the features we're implementing. So it will actually like, check in with you,
mm-hmm,
right? So think about it this way. In the best case scenario, like in an ideal world, that patient you're talking about would
mm-hmm,
have like, and say you had infinite time and you had a bunch of people who could do what you do, they would have someone like going to their home and checking on the wound on whatever kind of time interval seemed reasonable. Twice a week, every day, depending on the wound, whatever kind of suits the situation. Now, that's obviously not feasible, right? Like you can't go to everyone's house and check on their wounds. But what you could do with AI is create something that, is a surrogate for that check-in, right? Where maybe they're taking pictures and it's documenting
mm-hmm,
improvement or regression. And that improvement or regression is then used to notify you like, hey, they're supposed to follow up at the end of the month, but
mm-hmm.
you might want to see this, earlier rather than later. And so these are kind of what we're trying to do is think of interesting ways to use AI to improve care at little to no cost.
So, okay, I have another, like, little weird question. So, how would something like primary intelligence app deal with a patient who's like a hypochondriac? Like,
Yeah.
where is the fine line when it comes to that?
Yeah, this is exactly why you need physicians in the loop, right? Part
Mhm,
of the problem with these models is that they can be what's described as sycophantic, meaning you can convince them otherwise. So, say you have someone who's a hypochondriac and the model output says, this will probably get better, something like that. Talk with your doctor, but this is, these are kind of the things that they're likely going to talk to you about. And then if someone keeps telling it like, no, I think this is cancer, something like that, you could probably get the model to, with enough, emphasis to change the outputs. And so
mhm.
that's why it's dangerous for people to be using these on their own without a physician
So,
or
usually
provider.
so it should be the physician, the patient, and the primary app. So, like, a triangle together.
Yeah, like patients should not, in the same way that like you shouldn't use, for example, Google to try and
Mhm,
figure out what's going on and then go get, prescription that's over the counter for,
mm,
animals and
mhm.
give it to yourself. Like
Yeah.
you shouldn't be treating yourself. This is all just information and it has a
Mhm,
chance of being wrong. And especially, if you are trying to modify the outputs,
mhm.
then of course you're not going to get an accurate output. And so these are like any technology, there are cases where it doesn't work well. And it doesn't work well on its own. And so that's like a very like obvious wide range of cases where it doesn't work well, but it works well when you're going to be talking to a physician anyways. It works well
Mhm,
to help inform you. And
mhm.
really what we're trying to do is get most people to get better information before their doctor's visit.
Before the doctor. Yeah, because that's the thing I like about primary intelligence, the information that the patient gets. Because another thing that we deal with, especially with diabetics, they don't understand how serious the disease is. They think
Yeah,
amputation, but they don't understand how serious having a high hemoglobin A1C is. Like how the risk just like doubles or triples with
right.
the hemoglobin A1C, or that, you should see the vascular or you're at high risk of cardiovascular problems, things like that. And so I feel like if a patient knows exactly what type of disease diabetes actually is, it's not just sugar. It's not just sugar and it's not just a possible amputation. They'll be more compliant because they said the more the patient knows, right, the more compliant they are with the treatment plan.
Yeah, exactly. Some of it too is that patients, I think, like sometimes don't, they either worry about physician judgment or provider judgment, or they're embarrassed. And our hope is that they will be a little bit more open with the models as there's no like egos involved, right? Like you don't have to like be afraid that the model's going to judge you or anything like that.
Mhm.
It's just a language model. It's like a text prediction model. And so, that's kind of a hope, is that for people who are, maybe resistant to going, they can at least inform themselves as to why they should go, if they would otherwise without primary and just not do anything. The other thing we're working on is a lot of patients might not even know what kind of screening they should have. And so
Mhm.
like one thing we integrated is like the US Preventative Task Force Services. Like they have like grade A and B recommendations for screening tests that people should get. And I know, like, at least for my mom, like, she didn't get some of the testing with her regular primary care visits just because they never mentioned that she ought to have those according to those recommendations. And so we're trying to also use the evidence-based guidelines that people should have or have recommended for classic like screening testing, that people are up to date on those things. And so we have another kind of area within the app where people can kind of go through those to make sure they're getting all the appropriate testing that they ought to have for, the information they provide.
That would be
Things like
amazing.
simple things like colonoscopies or
Mhm.
mammograms or things that people might not even realize that they should have had already according to, publicly available, consensus guidelines. But sometimes, providers are very busy and you might not
Yes.
be able to kind of check and go through all those things. So this is just another way we're trying to arm patients with information so they can advocate for themselves.
I like that, Dr. Zimmerman. So this episode has been one eye-opening conversation. Is there one more thing you would like the audience to know about primary intelligence?
No, nothing. I mean, we're just building it kind of publicly. And so if any of your listeners have anything they want us to build or where they feel like there's a real deficit in how people are getting their health information, reach out to us, let us know. Like, you can find us on social media. You can find our website. You can even give us feedback through the app. But basically, we're just trying to build something that people want to use, that people want to help them on their health journey. So people don't have to be so scared of the kind of foreignness of healthcare. So, I guess that would be the only thing, is just a request for help building whatever you guys want.
For patients to say, this is what I would like to know for the future. Okay, that's really
Exactly.
super helpful. Is it possible I could send a list of things? Because I'm just
Oh,
thinking of all my,
yeah.
yeah, because I was just like going through my head all the troubleshooting that I would love for patients to know. Like, I love that concept of the screening. So that's
Yeah.
super helpful. So
Yeah, if
today,
you have screening guidelines you want us to include,
yes.
offline, give them to us, because those are very easy for us to incorporate.
And hold on, another question. You said that y'all incorporate the research, like the latest research
Say
when
that
it
again?
comes. You said that primary intelligence incorporates like the latest data research.
Yep. Yep. We're trying to include it as much as we can. We're not, so our system doesn't function like what they call them, RAGs, retrieval augmented generation. We have not incorporated that yet. We have part of that built out, but that space kind of changes very quickly. But yeah, we do try and include information, especially in the screening. Like, we have attachments to the actual screening protocols so people can actually look at the protocols themselves if they're interested.
Okay. Yes, I hope everybody. I honestly, I really, really love the concept of this app. I sincerely believe that this could be something incredibly huge, and that is part of any patient's treatment protocol or plan. And hopefully, any person with a cell phone would have it, just in case. That'll be
Yeah,
great for that because everybody has a cell phone, and no matter
exactly.
what, health tables turn when it comes to health. So
Yeah.
that's something to always keep in mind. So it'd be cool to have something like that on your back burner instead of just going on Google. You know for a fact, like if I go on primary intelligence, this is something that is like actually certified when it comes to these Ivy League doctors knowing and the data, and it'll give them a better direction of where to go.
Yeah, I mean, that's the other thing I didn't really mention, but we really only have two main goals, and that's user, or, if we turn into a health entity, eventually patient outcomes, and then privacy. And so basically, we're building in a space that I think, others are entering. ChatGPT is entering. They have, I think, ChatGPT Health, but these organizations, while they're still trying to do good things, their primary focus isn't benevolence. Like, they are developing a
Mm.
company that is geared towards generating revenue. That's not our goal at all. Our goal is to basically build something with people for exactly what they want and what they need, that is based in evidence and based in, trying to improve health outcomes. And so that's kind of our main goal. And so, yeah, I mean, it's going to be a journey, and we're going to need help from people in terms of, helping us know what to build. But yeah, that's our goal. And so we're looking for co-conspirators, so to speak, on who want to build a better system.
Okay, that's great. So thank you, Dr. Zimmerman. I hope everybody hears that literally this man has an app that is made for the patients. So now you actually have something to help you advocate for yourself. So I hope everybody checks it out, Primary Intelligence. It's an app, but you can actually go online and check out the website too and be able to download the app. And for everybody listening, this is Diabetic Foot Files with Dr. G and our guest host, Dr. Zimmerman. And this is all about connecting innovation, insight, and the real world care to change the outcome and help save lives. Until next time, stay sharp, stay curious, keep listening, and take care of your feet because they take care of you. And thank you again so much, Dr. Zimmerman.
Oh, thank you so much for having me. This was a blast.
Really? Okay.